experimental use, there are peer groups. They are actually to do the intervention and take them to the recovery, or stop them being into the phase of addiction. Whereas in circumstantial use, it is little difficult because it is available on the market. It's always there in their front of them. So the treatment is important, and then for the treatment, you have to undergo to convince them and undergo a decent, as a long-term treatment. This is the vicious cycle of addiction and recovery. As you can see that, like most of us, and it happens to many people like us as well, that we drink and then it feels us good, it makes us feel good. Sometimes we feel we were unable to sleep properly, and we sleep poorly. Next morning we wake up and we are like, we promise that this is the last day and we are not going to drink anymore any longer, right? And then by the evening the anxiety increases and causing us to lose our willpower, and then we drink again. So this is the vicious cycle of addiction, because when any drugs or any substances, when you take it, you become dependent on it. When you become dependent on it, it's like your body demands it, and until and unless you don't get it, you don't feel good. You must have seen that there are many people who needed a cigarette or maybe a tobacco, some form of tobacco, to get fresh in the morning. Some people need tea or coffee. So their body, because they have trained their mind in a way that if they don't have it, they are not being able to get fresh properly. So this is what drugs do to our body, our mental health and our physical health. So it creates a demand, and then eventually we become dependent on it, and we can't do beyond. If we don't take it, we can't do anything beyond that. Do you know that only 5% youth in the world get substance abuse treatment? Of all these children who are getting addicted to this. So treatment is also very limited. That is why we must emphasize on prevention, because treatment is very expensive in these days. $1 spending in treatment or prevention can save up to $100 in treatment. So it is very important. And as a teacher, and as a community, it is our primary responsibility to ensure that children get good education and they do not get indulged into this. Now, there are multiple factors for this which are responsible for the context of developmental changes. Like there are biological changes happen, puberty, and then curiosity happens. Then socio-emotional changes happen, because initially you might see that the children are like, once they are 8, 9, 10, they are with their families, but gradually when they are 12, 13, 14, they started spending more time with their friends. So these changes occurred into that phase, and it is crucially important to know who are their friends are, where are they going, what they are doing. So it's very, very important. Cognitive, there is a changes in that perspective as well. There are behavioral changes. They want to take more risk in that age, and they wanted not to be guided by any rules and regulations. Many of you have kids in your family. You might have experienced that if you say something to them that you don't do it, they will eventually end up doing it. So there is always a way. So in the later stage, we will talk about that, how to address such issues with the kids. All right. Then there is more rapid progression of addiction. Developing adolescents' brain are ideal for drug use. Why? Because one is like it's not filled with so many information. They can take it. They have the resistance power. So they are in the development stage. So and they feel and I have come across cases where children say that they started doing this because they just want to fit in the group. So they have a group where everybody is doing it. Now, if they don't do it, they want to try to fit in the group. Also, there are kids, at this stage, 12, 13 years of age, where children mostly tend to be friends with elder children who are elder than us, like 17, 18, just to feel more masculine, particularly among boys. This is a very common thing. And to fit in that group, they are willing to do anything and everything. And that ended up getting into them to addiction. I remember cases where there was a child who was from India, actually, Silampur, and he was again doing this. So initially his friends offered him drugs for free. So they did it for like a month, and once after a month, they asked him to, now it is your turn to treat us. Now it is your turn to buy us drugs, and he has no money, so he told them, I don't have money. Then they asked him, okay, let's go and snatch something. So they did do that, and he got some money. He used that money for by buying drugs. He did not got caught by the police, and he was like, okay, I can do it, I can do it, and that's how they become dependent on it, and the crime rose up, and the kind of crime they were involved in, it is heinous in nature. Many of them, some of them were in like used of murder, and then kidnapping, all sort of crimes you can imagine, think of. The drugs leads them to do. Okay, so these are some of the principles of adolescence drug treatment. Identify and address as soon as possible. This is very important that you identify them. There are some of the tips and tricks which will follow this presentation, where you can use these tricks and tips to identify if the person is using any form of drugs. That every child who has been on to that has a physical, emotional, or sexual abuse or other trauma that they have experienced, and this was there. Then benefit early. See, again, early intervention at the school level helps them not to become a drug addict, and it is very crucial and very important, not just for the teachers but for the school counselors and mental health practitioners to understand and know how to identify those children. I can give you some examples. For example, if a child is using inhalants, right? Now, inhalants is something that they sniff, and like they put it in a hanky and then they sniff. Now, if they're using that, you will see that there is a white spot in some of their clothes, maybe. And this spot is unremovable. Once it gets there, it is unremovable. So this is a sign, this is an indication that this person might be using their two teeth, their lips, this part of the lips will be totally and entirely black. So this is one such. If somebody is using heroin or smack, their fingers will be burned because they use these matches. So this fingers, you can see this entire fingers will be burned. So if you come across such things, like you can do that. If somebody is using marijuana, they will be finding it difficult to spit. They cannot spit because their mouth will be from inside, it will be dry, completely dry. So, it is again a sign and symptoms to identify kids with that they are potentially using this. Now, external pressure, of course, you should know that who their friends are, because sometimes they do, as I have mentioned earlier, they do it because of the external pressure. Most of the time, they don't want to do it, but because of under the peer influence, peer group, peer pressure, they want to do it. At the age of 15, 16, if you ask, most of the children will prefer to call their parents as Hitlers and friends their God. Like this is how they best try to establish the relationship and, the process. But later stage, of course, they understand it on a later stage, but it could be too late. Now several community-based behavioral therapies are available, and then again you have to know where to send. If you come across such cases, you have to know where to send these children. It is very important to understand, understand the kids' needs and understand the problem, understand the severity of the issues. So to address this, I can tell you a very interesting story on this. Why some people, it is important to know in depth what you are doing. Sometimes we think that we are, as a parents, we are doing great, but which may not be true. There was a monkey actually who was, it's a good story. There was a monkey who was sitting near a waterfall, and he suddenly noticed that there are 3 to 4 fishes trying to climb up. But every time they try to climb up, because the pressure is downwards, so they're unable to do that. So he observed them for a while. And then he decided, okay, if I want, I can help them. So he just took the fishes in his thumb like this, and then he tried to climb up, but all the fish went out. He tried it for 3 times, but he failed. Then he realized, I must change my technique. So he again did that. He closed his thumb like this, and then he climbed up. When he reached the top, he was feeling great that I did a great thing for kids. I did a good things that I helped them to climb up there. They were trying for so long. So after he released all the fishes on the sea, he noticed that all the fishes were dead. Now he's a good person, he wanted to help people, but the problem is he doesn't know how to help. And when you doesn't know how to help, instead of helping, you actually kind of ruin the entire thing. So this is very critically important. And at the same time, when you communicate with kids, you have to make sure that you are not introducing drugs to them. Because if in a class there might be 100 kids, everybody has a different way of accepting or information, right, or processing information. There might be some for whom it's an introduction, like when you talk about ganja and you are talking about ill effects. Now for him, he might only heard that ganja and some of his friends might be using in the class. So they might started using it. So you have to, when you communicate, you need to be very careful how you communicate with them, so that this information is for their benefit and not for starting new drugs. Okay, so the family is also very important. Families and communities play a very vital role, and continuous interaction with them, it's very crucial and important, because unfortunately in India, and not I have traveled to many other countries as well. The problem is bigger here in Eastern Europe. Right now I'm working here. The problem is huge bigger, but again, it is very important because families are the first role models for children. And if there is something not right about in the family, it will definitely impact the child's mental health, and sometimes it leads to addiction as well. I have kids who have been steal alcohol from their father's cupboard, and they started using it from there only. Violence and child abuse and risk of suicide, of course, this is also an important aspect that needs to be addressed, and we must have to understand that when they are into this drugs, they are on the street circumstances and they are continuously being threatened, abused. Abuse is very common among children. It's sexual abuse, and child is the most prominent among all abuses at the street circumstances. Now, and again, once they are on the treatment, if you send them, so the detox is very important, which is last for maybe 7 to 10 days based upon the kind of substance they are using. And again, on the basis of that, the treatment can be further doing it. Now these are some of the signs that I was mentioning earlier about drug abuse among adolescents. They will start, you might see that they have started behaving differently without any reason. And they are not interested in family gatherings any longer. They prefer to spend, like for New Year, for Christmas, they rather prefer to spend their time with their friends than with the family, or any other if social events, gatherings. They prefer to spend time with their friends and not with the family. So you will see these changes are occurring, and it's a sign that they are into something. Other signs include is like there is a change in the peer group. You might realize that suddenly your son or daughter used to be friends with this particular person, but they are no longer friends, and he has new friends which you might not aware of. Carelessness and grooming, dirty hands, clothes, burns on hand, as I have mentioned for other drugs. So this could be one of the reason. Decline in academic performance, like they were good at studies, but suddenly there's a huge decline on that. Missing classes or skipping school. There might be children you may know in your school that who are not regular in the classes, and eventually often they miss the classes. Lose of interest in favorite activities, like which they used to like, now no longer it is their child. It doesn't matter to them. Changes in eating and sleeping habits. The weight loss, this is also one of the most common occurring, because there are kids, I ask them, if you get 100 rupees, what is the thing that you are going to do, who came to the treatment in our center when you were on the street circumstances? They said that we will prefer buy drugs over food. So that was the notion, right? So again, there will be this deteriorating relationship with family members and friends. Of course, this is also one of the, because they will be agitated. Everything you say, they are responding you with harshly. They doesn't want to speak. They are slamming the doors, and then things like that happens. Sore mouths, around nose, smells of smoke or solvents. You might get this smell suddenly. because again, if somebody is taking solvents, there will be a smell in the face. Then nose will also, sore mouth, of course it is. So these are some of the the sign and symptoms that you can look into. You can write it down, and then if you come across some of the like case, some of any of the symptoms you see in any of the child, it might be a concern and it needs to be addressed. Tend to normally parents and doctors tend to underestimate the risk of seriousness of drug use, because again, many people thinks that it's not happened to us. Okay, it's not happened to us today, but it might happen to us some other time. In 70s and 80s, the problem of substance abuse was nothing actually, but now it has gone up exponentially up. In Delhi itself, when I was living in Delhi and I was talking to people back there, they were telling me by 2000, there was no such, all the areas in Delhi were like clean, and there was no slum around it. But today, every good area in the Delhi has a slum around it. So now this is all happening there. So the problem is rising, and it is very important that if you don't take it seriously now, the next generation we are raising is probably a generation of addicts. Now, they faces children with addiction, the substance use disorder, of course, they faces multiple faces a lot of issues. And some of them is like exposure to violence and trauma, which is, again, it's very crucial and very important to address. There is something happening in the pool. I have a case where a child was been he was addicted to drugs. He killed his father. He killed his father because his father was involved in illicit relation with his own daughter, his own daughter. So he killed him, and his father was also an addict, and he himself was an addict, and he ended up killing him. So these are the cases, scenarios possibly could happen and go through in a child's mental, and it can impair his life, his thought process for the rest of his life. I mean, for a long time, it's very difficult to come out of such stress and trauma. So it is very important to understand, because most of the time you might have seen kids who are not doing well in the class. You might think that they are disobedient, they are not good. I mean, or they are not trying hard, but the reason could be different, something else. So it is very important to dig out this thing and then know what actually going in their life. Generalization drug use, lack of formal education, of course, dropout is one of the major problem in northern India. I'm sure Northeast India is much better in that aspect, but northern India is the dropout is very high there, and once they are into addiction, they lose interest and they just want to quit the thing. Gender equality, male focused society, of course. So this is also, I mean, we have to give everything to them. Legal involvement, of course, they get involved into crime and things like that. Multiple drug exposure. The poly drug users, all the children that I have come across are poly drug users. Now, poly drug users is like they are not concentrating on one drug. And they say they are using alcohol, they are using heroin, they are using marijuana, all form of drugs possibly available. They are using everything. Lack of stable parents, child abuse and neglect, multiple psychiatric issues, then unstable housing, lack of positive and supportive relationships, because this is very important, which is the most, please understand, drug addiction is a disease like any other disease, like diabetes, like cancer, like any other disease. Now, when people have diabetes or cancer, you don't leave them, right? But when it comes to a drug addict, you don't want to do that. Like one of my friend was asking me, like, if there is two tables, on a tea stall, and on the one hand, there was a person sitting with who is a rapist, but is well dressed and sitting there. You don't know. And there is a drug addict sitting there. Of course, he's a drug addict, so he'll not be like well dressed. Now you enter to the tea stall. Which table you are going to sit? Most of the people say that we are going to sit with the rapist table, because we don't know he is a rapist, and moreover he is a well dressed. So this is the ideology. We have to understand it's a disease and it can be cured, and there are thousands of cases of children who have recovered from it and they are doing pretty well in their life. There was a child, his name was Saddam Hussein, and he came to our center. And when he came, he was telling that his father died and he was doing drugs. So when he was informed that your father was dead, he was like, okay, fine, it's okay, it's not a big deal. He continued using his drugs, and when he came to our center, he told me that I am not going, nobody can, my father died, he could not change me, how can you think you will be changed? But I'm happy to say that he's been recovery for like last 8 years now. He's running his own. He's a good tailor. He learned that in our center tailoring, and now he's running his own tailor shop, and he's making a living out of it. He's married. He has a child. So he has improved, and it's not just him. There are thousands of such cases. I have come across where people have recovered and they are doing much well in their life. And honesty is one thing. Of course, if you once they get out of the cycle of addiction, they are a totally different person you can trust, love, and they can grow exponentially. So yeah, I have seen this case. So it is very important for us to understand that it's a disease like any other disease, and it can be cured, and with a positive environment. Now there is a stronger link between childhood trauma and addiction than there is a between obesity and diabetes. Two-thirds of addicts report being abused as children. That means the war against drugs is actually a war against traumatized people who just need help, and we all can play our part and role to help them to get out of this problem. Right. Now, trauma changes how there are multiple ways this trauma can change our children's behavior and children's brain actually. And like in children, trauma can impact the development of prefrontal cortex, the part of the brain responsible for connecting behaviors and consequences, problem solving, inhibition, impulse control. You all must know that. So once it is there, they are sometimes there are kids who are totally, I have come across children who have totally like silent. They doesn't want to speak, participate, anything, even when being in the treatment. And it took us like 3 months to make them open up and start talking and participating. So sometimes it takes a long time. But again, I'm saying that it's a disease and it can be treated. In certain cases, it may take a lesser time. In certain cases, it may take a longer time, depending upon the the trauma, the atrocities that they have faced in their past. Okay, so and now tips for working with traumatized children: set up a strong. You have to don't want to make them live this trauma again by discussing all these things. So they have to figure out a way to do that. Work with children to discover their trauma triggers and ways to stay safe, how they can stay safe. Focus on children's strengths, what they can do, and identify their existing coping skills. This is very important. Like some kids may be good at arting, because all these children at the street circumstances, they are good at something. There are many kids who are good at art. They developed a rap song, and it's so beautiful and so amazing, and they have performed it in many national conferences during our program, in different programs, in different events. So they are creative, but you have to find out what they are good at and emphasize on that and help them build their life and career focusing on that aspect. Now, effects of trauma on children, as you can see that, there are a lot of psychological factors are involved, physical involved, social anxieties are involved. So these are some of and I think Dr. Ralte will discuss in detail about all these things. That some of them are anxiety, depression, PTSD, poor self-esteem, blame and guilt, or under psychological issues, social issues, isolation and withdrawal, few social interactions, rigid sexual expectations. So these are some of the the effects of trauma and violence on children potentially could happen, and it is really important that children often can't tell you that they have been abused sexually or physically. It is sometimes a shame for them, or they are not ready. They don't know how to express it. This is one of the biggest challenge with who are working with children, to help to make them express, because sometimes they don't even recognize that it is a problem. So again, but it is somewhere in their unconscious mind, it is eating them from inside. So it is equally important. And then I have seen children shivering and waking up at night shouting loud. But when you ask them, it's like they are again back to normal. So this is something that we must understand and address it nicely. Now, how you can help, recognize children have unique treatment needs and barriers to get help. So this is very important to understand that, children are unique. You can't treat them as an adult. Now, for you, something may be not sounds like an adult, but may not be bad for kids because their understanding is something different than ours. Instead of like asking kids that you have to be doctor, you have to be engineer, you have to do this, you have to do this. Instead of that, ask him what he or she wants to be. Because as a parent, most of the time, we only direct them to do it. We never ask them we never involve them in the decision making process. We only make decisions for them. So which is again not a healthy way of dealing with children, because youth imagine and you think that they are children and they cannot make decisions, but that's not true at all, because in our time we do not have mobile internet and all these things, but today every child has access to all these informations and they are much more mature than back in our time. So it is important to ask them, and involve them in the decision making process and help them grow from there. Know the effective elements of treatment for children. Use healing words, not hurting words. I will share with you a list of words actually which you can often use rather than which we normally use. Screen all children for substance use at every visit. I mean, it is important. Even in schools there are some of the tools which are, I will share some which are important and it can be performed by anybody. There's a few questions in there, and then with that you can easily find out if this child is vulnerable to drugs or vulnerable to substances. And it is important for you to also know that if so, then how and where you can help that child. Like specific barriers for children is like recognition. As I have mentioned earlier, that it is difficult for kids to recognize that it is a problem. Lack of professionals to identify. I mean, this is one of the biggest challenge that we are facing in this area, that there is very few professionals who actually work in this field and have an understanding of this issue and severity and what it can cost to the country. Because please understand, after drugs, after oil and arms, drugs is the third largest business in the world. And you might not have even heard of it. So it's a $1 billion industry, and more customers they have, and the easy customer is the children. So we have to understand and address this, and there are need of more professionals to come into and involve into this field and help kids out there. I don't know, some of you may be from Silchar. I'm hoping, because it's like everybody's in the Northeast, so you might have heard that, there are a couple of treatment centers. I have visited one treatment center there, and the number of patients when I saw, I cannot believe that, it's not possible. There are 300 patients there, 300 at one time, and a lot of them are on queue. So the problem is not just in big cities, Delhi and Mumbai and Bangalore and all these places. It is now getting inside these small cities as well. And it's a severe issue and severe problem, and we all must need to understand this. Now, elements of treatment, of course, life skills are very essential. We have developed extensive curriculum, life skills modules on this. There are two. One is Suitcase for Life. The other one is Today for Today and Tomorrow. But I'm not going to, I'll discuss briefly about those. Otherwise, it will take 2 days actually presentation. So yeah, adequate treatment period is crucial. Of course, it is very important that there are some children who may not need a longer treatment, but there are kids who needs a longer treatment. So it is equally important, and identifying the facilities where you can refer them. Because even if we, as a teacher, if you identify a child and you don't know what to do next, because informing family and even the family is not aware about that, that is going to be a big problem. So identifying facilities is equally important and crucially important, and then sending them to those facilities, convincing them to stay in the program, and then getting out of it. And this is also, as a teacher, it is important to those who are not into addiction right now but has a high risk of getting into it, you can prevent them by knowing all these elements and helping them with this. Now these are some of the words which are stigmatized, but you can use them in a different way. Like instead of calling them addict, abuser, junkie, you can call them person in active addiction, person with substance misuse disorder, person experiencing an alcohol drug dependent problem, patients. User, don't call them user, but a person who misuse alcohol or drugs. Abuse, like misuse, harmful use, inappropriate use, hazardous use, problem use, risky use. Clean, dirty, negative, positive. You can again, you have to use your imagination to not to use this stigmatized word, because again, because of this, many of the children are unable to attain treatment just because it brings a shame to their family. And the problem is, if you think that only with children on street circumstances, that's not true. I have come across children whose parents are high-level bureaucrats, officials, both mother and father. There was a child whose both the parents were high-level bureaucrat, and they are high-level government officials, bureaucrat, of course. So, and they came to me, and they are like, my son is using drugs. I spoke to him, and he was using marijuana. And then I asked him why, what is the reason? He said that I do not have a good environment. Both of my parents are working, and I enjoy cooking. So I asked him, what do you like? And he said, I enjoy cooking. Want to be a chef, but my father doesn't want me to be one, and he wants me to be a bureaucrat. So I spoke to his father, and his father was like, no, he can't be cooking. He's not a woman. I was like shocked to learn that he's a person who makes policy for the nation, and this is something, it is coming out from him. So it was kind of a shock, and then I realized that okay, but we have been able to help him understand, and then cried, and then he's doing well now. Today he's taking his classes on hospitality, and then so again, the story is like, you need to understand and then find a way to help these children. And the problem is not just with split kids, it is happening with everywhere, every aspect of life, every tax of human, rich, poor, middle class, upper middle class, the problem is there. So it is very important to understand it and use it appropriately. Now, this is a questionnaire craft. I'm sure Dr. Ralte might cover it. So it's a simple test, and based on this test, you can ask these 5 questions or to the kids, to the children. And if each yes answer consists of 1 point, and if there is 2 yes answer, then this person needs some sort of treatment or substance use disorder, and further assessment is required. For further assessment, there is a WHO assist, which is universally recognized, and it is a very simple testing tools that teachers or the counselors can use to identify. There are 5 set of questions actually on that as well, and you can use that to determine if the person is vulnerable to, if it is he's a high user or a medium or a low. So you can value that into that using that test, and then you can easily address this issue. Now, this is a readiness ruler. Again, this is one of the other tests that we use normally to ask children about their risky behavior. For example, if a child is smoking, so now you can ask him, like, if you are smoking, your behavior, how do you want to rate it? If you want to quit it, if you want to quit smoking, okay, how do you see yourself of 1 to 10? If it is 2 or 3, it's like less motivated, doesn't want to quit. If it is 8 and 9, if they rank him 8 and 9, so they are seriously want to quit. So here you can help them grow there. So similarly with other questions also, you can, risky behaviors, you can ask them if they want to quit, and then they can do it. This is a very interesting tool that you can use, which is decision balance. And now you ask them, give them, you don't decide for them here. This is the most important thing, that you don't decide, you let them decide. So make a change, not changing. Okay, now both of them have pros and cons. So you ask them, like for example, you want to stop smoking, right? What are the benefits of it, stop smoking, and what are the cost of it, pros and cons, right? Now same thing again, not changing, you don't want to stop smoking, what are the benefits of it and what are the cause of it. Now in the not changing, you might see that the benefits is like, I will be able to accept it in the peer group, my friends are doing, I'll be macho, things like that. They are kids, so they will mention it like that, because they learn from these movies and all, where Ajay Devgan is in two bikes, standing on two bikes, smoking, entering the college. They think that this is like a macho kind of thing, but again, this is not true. And again, glorifying such things is also very bad actually, and we should not encourage children to follow that, because they ideally normally follow that. And this is our fault actually, when we are watching this type of things with our kids at home, that these ads comes in, nobody says to the children that this is not right, this is not good. So what they perceive is like, because he is a hero, if he is doing it, if Mahendra Singh Dhoni is doing it, or Akshay Kumar is doing it, so it must be right, it must not be bad. But so this is where the role of parents also comes in, or the teachers also comes in, to tell the children that what you are seeing on the ads it's wrong. They are doing it to have some money. That's it. They are not themselves using it. So exactly, this is very important, and most of us don't do it. So these are basic fundamental things that everybody needs to understand and do it. Now what teachers can do. Okay, so as you can see in the right side of me, first there are some negative words and there are some positive words which are replaced with the positive words. Now in the negative words, like there is short attention span. So I prefer to call that person a person with many interests. Irresponsible, carefree, hyperactive, energetic, impulsive, spontaneous, loud, enthusiastic, stubborn, persistent, poor planner, present focused, diagnosed, disorganized, unstructured, bossy, leadership, argumentative, committed, test limits, risk task taker, anxious, cautious, impatient, eager. So these are some of the words which are negative, but there are also the positive words of it. So you can see, when you start seeing things, there is nothing called problem. It is always an opportunity to test your skills, right? So when you see things like that, the negative words, instead of using those, if you use them in a positive way, you create a good rapport with the child. And the moment you create a good rapport with the child, you can help him or help her to become a resourceful person in the society. So this is very important. So and as a teacher, it is important that you recognize the role you play in the lives of children and families, because after family, children are spending most of their time with you. 8 hours, because 8 hours, if a child sleeps, 8 hours the child is spending with you. So the remaining 8 hours he is spending with his friends and family, divided into friends and family. But they are spending a high amount of time with the teachers. It is where they are. You have a very high responsibility to ensure that their well-being is taken care of. Recognize your role in helping traumatized children, and help your colleagues and caregivers see the children's behavior as coping reasons rather than bad. This knowledge will help ensure that children are not misdiagnosed with health disorders and that they receive appropriate interventions. And lastly, it's important for you to know where your community is referred to children for assessment and treatment. This is equally important, that you know where you can refer the case. Now, there is a question that whether do girls and boys have different treatment needs. Of course, they have a different treatment needs, because they are different developmental and social. They have different development and social issues. Different strategies or emphasis has to be given. Girls is equal to more mood disorders, depression, and physical or sexual abuse history. This is true. Boys is more conduct, behavioral, and learning problems, disruptive to school, family, or community. So they both have different needs. I have worked with both the communities actually, girls and boys center, and I have seen the differences. So there is a huge difference, and the program, treatment, everything has to be differently designed. Involving the family is especially important with your younger adolescents. because again, they are the first point of contact, and they have to caregiver, and then they have to be on board to take this matter further. Okay, under treating increased relapse risks. When you treat them well, the relapse risk is high. Now, in this section, we are going to talk about how we can, educate kids on substance abuse. So most of us, when we heard about drugs, what is the first thing that comes to our mind? I believe most of you are thinking probably that it is like alcohol or smack or heroin or things like that. But if you go to a pharmacy, you will see that it's written druggist and chemist. Right now, they are not selling alcohol or smack or heroin, right? So this is very important to help the child to understand that, and how you are going to make them understand in a very simple way so that they can take it. For example, you tell them that never take another person's medications. Make sure that you are the only taking the right amount of medication. Taking more medication than the direction specified can hurt your body. So when you start telling them in a very layman and a fundamental way, simple way, they understand these things. Without mentioning drugs, taking less or specifying each drug, taking less medication can also make it harder for your body to get well. So you have to take and you have to take medication only when the doctor prescribes. Other than that, don't take it. Now, many medicines can help you when you are sick. Okay. These medicines are often called medications. So that's how you have to tell the children. When you are sick, doctors can give you medications to make you feel better. These medicines helps fight diseases. They work to keep your body healthy. Now this is a body structure that you give. The importance of understanding why some drugs can hurt you. Now there is an exercise for that as well. Once you explain this to the children, like some drugs are harmful to use, many of these drugs can hurt your body, many of these drugs can hurt your mind. Okay, and now the effects of cocaine or crack on your body. What does it affect in your brain part, nose, throat, heart, skin, lungs? And depending on that, then you ask the children or give them a human structure like this, you can see in the screen, and ask them, divide them into group and tell them that, okay, now this group is going to talk about the effects in the brain. This group is so this helps them, this exercise helps them to memorize these things, understand these things in a better way, and so that they can remember these things and what things that they should not do. Now, prefrontal, everybody know prefrontal cortex, dopamine and all these things, but children, it is difficult for kids to remember all these things. So we refer them as a owl part of the brain, right? Now, the owl part of the brain helps you make decisions and think about future, right? Which is cortex, of course, prefrontal cortex. So this is responsible for that. Now, the fireworks part of the brain, which is again the dopamine, which makes you feel good and great, and then you enjoy about that. And the barking dog is a part of the brain which makes you feel fear and anger. So these are the way that you have to educate kids about drugs and about the brain and all these things. And then there is a story, follow along, and then you can explain the stories to them. And then ask them again, you did the story to the children and ask questions to have them decide how the drugs helped or hurt people in the story. So again, this is the same thing. And then, so this is the importance of understanding why some drugs can hurt you. Now there is a case study here, which is about a girl named Davi. Takes drugs every day. He takes so much that he does not go to work. No work means the family goes hungry. When Davi takes drugs, he stays away all day. His children misses him. When he comes home, he hits the children because he does not feel well and needs more drugs. Does the drug Davi took hurt him? So you have to ask this question and to the children and let them answer these questions. So that, and again, you can use your imagination to develop imagination to develop stories and which relates to their daily life. And when you say these stories, you might come across kids that they actually have been probably going through that. There might be children who are at home where their fathers come home drunk and beat their mothers, beat them, and so you can find that things with that stories as well. So this is very important to do that. You can play these doctor patient games that we used to play with kids, and it is very useful and successful. There are role plays where a person will play the part of a doctor, and the other person will play the part of a patient, and then explain them how they can address this, and give them a scenario and role, because when they role play things, they remember this for a longer time, and it goes into their mind. So it is very really really helpful. Now, managing peer pressure is very, very important. And there are a couple of drug refusal skills that you should practice with the children, and again help them to get rid of this. There are 9 possible ways of drug refusal skills. One is just to simply say no thanks. Give a reason, fact or excuses. Sorry, I gotta go. Something going on at home. Walk away. Change the subject. Use humor. Broken record or repeated refusals, continuously say no, 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 because there will be a peer pressure. Of course, once they are into it, they will want other kids to be into it. So there will be a peer pressure, and it is important, equally important for us to overcome those peer pressure. The cold shoulder or ignore, avoid the situation, strength in numbers, right? So now these are the exercise. These are some of the role plays. Actually, there are situations where you can organize in the class and then ask a group of children to sit and perform this, and then there will be children who will use these 9 techniques to avoid this situation. So they will actually have the real life experience of how it feels, and how they can persistently ignore and say no to drugs. Now, this is some of the summary of the presentation. After you finish this, I can share this with you. We have 9 modules. One is communication on relationship and everything, and I'd love to share with you. And if we get a chance, I'd like to train you on these things, which is because we have trained in teachers in Delhi back in India when I was there. Over 5,000 teachers have been trained, and they are now using this in their schools in Delhi. So many medication can help you fight diseases. So these are the summary after you finish your presentation with the children, after you perform all the activities, and then you can summarize this thing for children. This is the summary of the presentation, that what we have learned. And drug use disorder among children is a growing problem in India, and teachers play a very important role in screening and identifying signs and symptoms of substance use among children. Children should not be treated like little adults. Their treatment needs are different than from adults. So, and you have the power to hurt or heal children have substance use disorder. Know how to talk to children, see their strengths, and know where to get them help when needed. Thank you very much. I think I am on time. And if you have any questions, feel free to ask.
Questions if you have any, because I'm sure you might be thinking of some things when you, after having gone through this whole presentation. Thank you, Mr. Shibendu. It was a very holistic and insightful presentation. The best part was that we could see things, how things which we have never even thought of can be impacting the child's push towards substance abuse, and giving including things like the economy of the substance abuse, because if it's one of the most lucrative businesses in the world, definitely it's going to be very difficult for us to manage substance abuse. So thank you so much for these things. And we have also, I think, something which because this whole conference is about empowering teachers, and some points that you made are very, very relevant for use by teachers. They could use these things and simple tools, the craft questionnaire and the decisional balance. These are things which is not something which needs a lot of resources. Teachers being aware of it can bring it to use in their daily dealing with the students. And some important points like recognizing the important role you play in the lives of children that you said for teachers, and which is the focus that we are trying to give in during this conference, that teachers can make a difference. Knowing where to refer, because yes, that's important, and some of the differences that we generally see substance abuse very globally, and we do not realize how it impacts different groups of children in different ways. So highlighting how like girls seem to be internalizing more and boys seem to be acting out more, and these would be, but yes, I don't know whether people in the audience have a question, but I personally was thinking that some of these signs and symptoms might be coinciding with the whole adolescence phase. So when you were talking about slamming the door, or getting annoyed, or sleeping for long hours, I thought that maybe there could be an overlap between the signs and symptoms of substance abuse as well as just being in the phase of adolescence. So how do we really differentiate, and how do, but yes, maybe we will look at some more behaviors, not only these two, three specific behaviors. And one more very important thing which I would like to reiterate here is uh, that some things which we are doing, we do not realize that they are going to make an impact on our own children. So we were discussing earlier about we being models for our children. So when you narrated the case of a child who was getting the alcohol from his father's cupboard, it's the alcohol being present in the child's context desensitizes the child towards negative impact. So maybe we need to think about what we ourselves are doing. So thank you so much, sir, for your for setting the tone for the next part of the session, where I would be now inviting Dr. Ralte to talk about the other aspects of substance abuse. And I will just begin with a brief introduction to Dr. Ralte. But I would also request if Sir, and Sir, thank you so much for joining us all the way from Bulgaria. I would request if you have time, maybe before we invite Dr. Ralte, I'll pause for 2 minutes and see if there are some questions with Sir, because he might want to leave. Carolyn, yeah, please. Carolyn, you can come and ask from here. Oh, acha. Fine.
A very good afternoon, especially to you, sir, and to all my dear friends and who all who are present here. By what the data that you were sharing, it's very alarming, we can say. And we're talking here about other children. So the percentage and the number that has been given or that you had shared, if 2/3 of the abusers are children and who need help. And most importantly, our children, it's very difficult for them to express. So as teachers, perhaps, especially for those at the lower classes, how can the teachers help the children who are inexpressive? Perhaps the external behavior cannot be made out by a teacher. So for those, how can the teacher help with such type of children, sir? That is one. Another question is perhaps the data that has been narrated, it's about those that has been recorded. But there are so many children at large, we can say, that has not been recorded, that they are substance users. So for such type of children who perhaps are not school goers, but are somewhere, maybe on the street, maybe at home, maybe unidentified by any of the society organizations, or perhaps the society at large for them also. So what kind of help or support can be given to such type of children? Thank you.
Thank you for the questions. So I would like to answer your first questions, how teachers can help on this aspect. See, the first step to resolve any problem is to recognize there is one. Now, the moment you recognize that it is a problem, you are halfway through mark. And after that, with some basic trainings, because see, I understand that being a teacher, you are attending almost 50 to 60 children at a time, at the same time. And it's very difficult for you to, identify those who are in need. But once you can do, because again, you can monitor those kids and see them who are participating well and not well. And then there must be some counselors in your schools. If so, then you can refer all those children always. And instead of, this is also because there are a lot of children who have reported that because of the humiliation that they have to receive in school, sorry to say that, I'm sure you don't do that, but there are teachers who does that, and then because of that they drop out of that. So the moment we understand this and we stop doing this and focusing on the well-being of the children, we can really help. And if you recognize that substance abuse is a problem, I mean, I think you will have a better understanding, and you can, do it much better in this aspect. There is some trainings are available online which you can do it. There is a NIDA site actually, and there are specific trainings for teachers available to identify that, and these are free. So you can take those trainings and help yourself grow more in this aspect and know more about this problem and issues and how to address this. So this is very important. Part of your second question was there are more children. Of course, the data is, again, the number which I showed in the data is much more bigger than of what is there actually, because they are not being contacted. Now, there is a lack of political will, and this has to come from all aspect of the society. Children don't vote, so that is why they are not no government is taking them seriously, and particularly this issue. So when there is a lack of political will, to bring it in issue, if there is a memorandum, if there is a letter from your area that if you recognize this, there is a problem, write it to the appropriate authority to do something, do some awareness programs. So more we talk about it, the more we can reach out to children. Because today, to be honest, what we need is in every school, because I lived in America, I have been in America and Europe right now, and every school they talk about substance abuse. There is a chapter, there is a curriculum on this in their school curriculum where they teach children about harmful effects of drugs and everything. It is a part of their curriculum. It's like they sit for an exam on this and then they do it. So if it comes from the teacher that there is a need of this, the government will be forced to make more investment onto this aspect and onto this subject. So I think this is one of the most important things that the teacher can also do in their respective areas. But recognizing that you have recognized that it is a problem, which is the first step. And if you recognize that, I mean, the changes will definitely come. I hope I answered your question. I can't hear you.
Hello. Hello.
Hello. Yeah.
Yes, sir. Just to add to towards what you were saying, the dirt of the problem here is because we do not have school counselors. So not all the schools, especially the government schools, we can say we do not have counselors. So that is the crux. By the time it reaches to the concern, so it becomes too late. So here the prevention as the key also, it becomes a fail. So that is the main problem, I can say.
I know that because when I started working back in Delhi, we have to involve judiciary into that. So the judiciary was there. The judiciary directed the government to appoint counselors. So now MCT schools and all Delhi government schools have counselors. It was not there. It is us actually who involved the High Court of Delhi and then the Juvenile Justice Board in the periphery, and then we convince them to take it further. And then because again, this is also one of the idea I'm giving you, that if you can use this as judiciary as a tool to convince government to do something like that, because this is very important.
Thank you so much, sir. I do hope that we will be able to have you for a longer training sometime on substance abuse.
Sure.
Thank you very much. And now I would like to introduce our next expert for the day, Dr. Lalchan Hima Ralte, and he is a consultant in HIV and substance use disorder in the Presbyterian Synod Hospital, Aizawl, and he's working in this field since the year 2012. Dr. Ralte has an MBBS from Bhopal and his post-graduation is in public health from Trivandrum. He is interested in the areas of HIV, substance use disorders, trauma, and adverse childhood experiences. He also is a former Humphrey Fellow on substance abuse from the from the Virginia Commonwealth University, Richmond. So I would now like to invite Dr. Ralte for his session.
Hi everyone, so good to be here. So let's go from Bulgaria back to Shillong. I'm Ralte and I'm from Aizawl. I just reached like 1 hour back, came straight from the airport and so excited to be here. I have lots of slides, but I only have around 1 hour. So I'll look on the organizer to like stop me. So I was thinking maybe we'll also do a little bit of group work as well. I would love to know what your thoughts are on some of the topics that I have for you today. So I work at the Presbyterian Hospital, which was started by the Welsh missionaries back in 1928. Consultant in HIV and substance use disorder. We have a separate department for HIV and substance use disorder. So my everyday work is OPDs and inpatient ward rounds for people with alcohol and drug issues. So that's what I do every day. We'll go to the next slide. Yeah, thank you. So my initial plan was to have, at least maybe 2-3 groups and see what your thoughts are. So I don't know whether I think they're quite visible. So I would really love to hear, you guys are teachers, so I'm expecting you to speak up and, say what's on your mind, your thoughts. So the first question that I have for you is what comes to your mind when you hear the word addicts? Actually, in the US, they do not use the word addicts anymore. We are supposed to use the word substance use disorders or substance dependence. But for the Indian context, I'm still keeping the word addicts. So what comes to your mind when you hear the word addicts? What are the first things that comes to your mind? Would you like to share a little bit? We don't have so much time, so if you could, yes, please. Yes. Sorry? The weak person goes to addiction. So that's what comes to your mind when you hear the word addicts. Smoking alcohol comes to your mind as well. Yes. Drugs comes to your mind. All the negative attribute comes to your mind. Let's go on to the second one. What are your thoughts on the statement? Addiction is a moral weakness or is because of moral failure? What are your thoughts on that as teachers? I'm sure you must have seen some patients, let's not say lots of your students, but some students who are into substance abuse. What are your thoughts? Do you think it's a moral failure? Do you think it's a moral weakness? What are your thoughts on that? Come on, people from Meghalaya, I want to hear you. What are your thoughts?
It's not a moral failure, sir.
Sure. Internally happen.
It's an external manifestation.
External manifestation of something which is happening internally. Yes. Mental health issue. Yes.
I think it stems
Yes.
from a sense of helplessness.
Stems from a place of helplessness. Yes. And sure.
But it is a matter of choice.
Matter of choice. Nothing to do with moral weakness or failure, but matter of choice. Yes.
Let's go back to the first one.
Yep. Yeah.
Thinking also now that is an abusing.
Right. Stigmatizing, right? Yes. Yes.
Don't use the word addictive,
Mhm.
use that.
Yeah. Can be very cultural and specific. Yes. And yeah, Yeah, anyone else? Okay, let's go to the third one. What do you think are the characteristics of drug users, alcohol users? Obsessive. They isolate themselves. Yes. Introverts. Yeah, what comes to your mind when you think of users? Like, how do they behave? They usually have low self-esteem, yes? Sorry? Yeah, low self-esteem, sorry. Escapism, yes. Yeah, those are very interesting. And I am from a state where the church has lots of authority over the understanding of, even substance use and addiction in general. So I guess some places addiction is still seen as a moral weakness and as a moral failure, something that a person decides and don't decide. So let's go on to the next one. So this is how the American Society of Addiction Medicine defines addiction. I would really love us to focus on the words that I have underlined. It's a treatable situation, disease, or a condition, and it's a chronic medical disease. So the definition has also evolved. So now it's a chronic medical disease. In fact, it is called as a chronic relapsing disease. They abstain and then relapse again. That is considered as a norm of the disease of addiction or substance abuse. And also is a complex interaction between the brain circuits. Some things happens in the brain, which we'll talk later. And also because of genetics, sometimes it can be passed on, and because our environment, easy availability, and especially Northeast because of our proximity to certain neighboring countries, and also because of individuals' life experiences, which is one of my favorite topics these days, especially after my Fulbright Fellowship in the US, how adverse life experiences could impact us later on in life. So all this comes together to, in defining what addiction or substance use disorder is. So it's not like one factor which leads to substance use dependency. There are so many factors which comes together leading to the disease condition. So when do we define addiction? So the first point is when there's a strong desire or a sense of compulsion to take the substance. There is a constant desire, and then there is a compulsion to take the substance. So you have the normal drug users who just use for maybe a couple of days and then stop again, and then there are people who use in a harmful way. But what we are talking here are people who are dependent, or again, let me use the word addicts. So when there's a constant desire or a sense of compulsion, and the second point is when they do not have control over the onset, termination, or the level of use. And the third one is whenever they stop using the substance, there are physical conditions in the body, like with alcohol, they would have impaired vision in the sense that visual hallucination, they would see things, they would hear words, or they would have vomiting, or sometimes there would be sometimes they have to be tied down because they're so delirious whenever they stop using alcohol. So when it comes to that situation, you can say that, oh, this person is now addicted to alcohol. Or in the case of heroin user, they would have body aches, they will be sweating, there will be watering of eyes, and all kinds of water coming out of the body. Those are the symptoms which happens when a person stops using substances, and you can say, oh, this person is now dependent. And then the fourth one is when they need to increase the substance, as in like he was used to drinking 1 glass of alcohol, but gradually it has become like 2 glasses, 3 glasses, which means there is tolerance, there is increase of the substance they're using, so which means that the person is now addicted. And the fifth one is when usual, normal, daily pleasures in life are not interesting or are not fun anymore. So if you look at users, Studies do not matter anymore. Playing with their kids do not matter anymore. Of course, they still love them. They love their wives, they love their kids and everything. But because of substance abuse, these things do not matter anymore. Neglect of alternative pleasures or interests. If you look at, say, a former football player but got into substance abuse, is not playing anymore. There is negligence of whatever was fun or pleasure in their life. The last one is when there is a continued use of the substance, irrespective of the physical consequences that they are already facing. Like the guy already has severe jaundice, but still continue to use it. The guy already has hepatitis, but keeps on drinking. The guy already has HIV, but still on injecting himself. He knows that he already has physical complications, but continue on using the substance. So it means that the person is already dependent or addicted. So these are the 6 points that we use as medical doctors. So we look at all these 6 points when we see patients. If at least 3 of the points are continually happening in their lives, it means that a person is dependent on the substance, be it alcohol, weed, or heroin, whatever the substance they're using. So let's go on to a little bit of anatomy. We can't dismiss the brain when we talk addiction. This is a real human brain. The brain has been described as the master organ because, as you all know, it controls and coordinates the functions of the human body. It's around 1.3 kg on an average. And let's go to the sagittal section or the side section of the brain. Next one. So if you can see from there, those are the various functions of the brain. The brain is an organ which is quite, quiet, but is so powerful at the same time. I would really like to focus on the middle part of the brain. I think okay, you can see the yellow wording there. So memory and reward. That's one really important function of the brain, which I am planning to talk about today. So as we all know, thoughts and decisions, memories and emotions, movements, perception of pain, temperature control, everything is regulated by the brain. Like I've said, so quiet but so powerful. So let's focus on reward and memory. So in the middle of the brain, we have a small organ called the hippocampus. I don't know how many of you are science teachers, so I'm sure you know about hippocampus more than me. It's a brain structure which is right in the middle, and it's responsible for memory. This is the part of the brain which memorizes everything, right? So let's see. Momo is my favorite food. I guess it's, favorite food for the Northeastern people. So I had momo this morning and momo last night as well. So yeah, I love momo. So why do I love momo? Because my brain, the hippocampus, the one in the middle that I just showed you, remembers like how tasty it is. Once you remember and record how tasty it is, it's very difficult to erase the taste and the sensation and. So not only that, it also helps you remember, like when I say momo, the first thing that comes to my mind are the people I usually have momo with, the places where I eat my momos, my favorite momo. I know where my favorite momo is in Aizawl. So, and I also know when I usually take my momos. So that's how the brain memorizes things. So in the same way, so when we, eat food that we like or do things that we love doing, or something that interests us, it's because of how it makes us feel in the brain. So here at this point, I have to talk about the dopamine. So dopamines are those chemicals which are released in the brain whenever I eat my momos and whenever I do something which I like and which I find it, interesting and fun. So God has made us in such a way that dopamine is released in our brain whenever we do such things. But what happens when someone takes drugs? Especially what happens when they inject themselves with heroin. Let's take heroin as an example, since it's one of the most preferred substance of abuse in the Northeast. So what happens is that just as I remember how I loved my Momo, the brain also remembered, you know. And if you look at the slide here, and if we would compare the next one. So the brain on the left side is a normal human brain enjoying something that he likes. It's maybe eating momo or shopping or traveling. Traveling in my case, I love to travel. So even when I just talk about travel, dopamine rushes. Versus the brain on the left side of the screen. So that's a brain on heroin use. So you can see the amount of dopamine which is released when someone uses heroin. So it's something that the brain has never ever felt before. The brain was never made this way to release, this amount of dopamine in the brain. This was not how it is supposed to be. So it's really difficult, once the hippocampus remembers, it automatically remembers, like when I see Prachi here, I would give Prachi as an example as someone who is my drug addict friend. Whenever I see her, I would remember, oh, so she's the one that I take my shots with. Automatically it will come to my mind. If this place was where I take my heroin, whenever I go to this place, my brain will remind me, oh, this is where I do my drug, and this is where you get the maximum number of dopamine in your brain. So that's how it works. So once the brain registers, it's so difficult. It's not impossible, but it is difficult. So we've been to the US, like Prachi and as Shibendu, the presenter before me, we are Humphrey Fellows in the US. We've learned substance abuse. We've visited places all over the US, and personally, I've been traveling around different parts of the world, looking at treatment centers. Everywhere, they find it really difficult. I mean, they have the same problem that that I'm discussing right now. It's not impossible. Even in places in developed countries where they have excellent treatment centers, they still find it really difficult to treat substance users. So my focus has always been more on the prevention side, like how do we prevent young people from not using substance? Because once you remember your favorite momo, can you ever forget that? And imagine the number of dopamine that you get with a momo versus heroin. So, it's tough. I'm not saying it's impossible. I have seen so many of my patients doing really well, being abstinent and stuff, which is all great. But most of the time, once a person is dependent on heroin, it's so difficult to move on. Yes. We were supposed to do this as well, but I only have around half an hour now, so I think I'll just skip this. So age of initiation. So this was a study done by the Social Welfare Department, Mizoram in 2017. And I think this was a great study for our state and maybe even for the other Northeastern state to have a general idea of how our young people are initiating substance. So 15 years, I guess these are your student age group as well. Mostly initiated with tobacco and solvents. I don't know how popular solvents are in other parts of the Northeast, but in my boys love dendrite and sniffing dendrites and thinner and other solvents like that. So they usually begin around 15 years. Alcohol around 16 years. Cannabis around 17. Cannabis, weed, ganja, marijuana in the US. 19 years, prescription opioids, maybe tramadol, codeine stuff, and then injecting usually by 19. And yes, sedatives, I think should come maybe even 15, 16, but the average come out around 20 in Mizoram, and then heroin by 20. So I thought this might be of interest to you because the younger, if you look at the age, they usually start off with tobacco solvents. These are, as you know, the gateway drugs. Usually when I talk to my patients, they usually do not inject with heroin straight away. They usually start smoking, tobacco, alcohol, and then slowly graduate it to the hard drugs. So it's important to know that this is how the trajectory or the pathway of initiation is like. And the reasons for initiation given was, the first one was like nearly 60% of them said, again, a study from the Mizoram Social Welfare Department. I should also mention that the sample size was around 3,000, which was done all over Mizoram. Friends were injecting and they wanted to try. So in the beginning, we mentioned about the importance of environment, friends were injecting and wanted to try. And the second point was they thought it would be a better high, which means they were already on other substances of maybe some of the gateway drugs. Maybe they were already on solvents and they wanted to try something new. And the third one is because of curiosity. Of course, I will blame this on the adolescent brain. Let's go on to the next one, which is a little bit on the vulnerability of the adolescent brain. This was something that I learned from the US. I was like, oh, they're young people, so they wanted to try out. So that could be the reason, But what I've learned was, this was from the Harvard Center for the Developing Child, excellent center for the developing child, where they learn about the brain and how it affects addiction and diseases later on in life. I do not have a pointer. So if you could look at so we have two sets of brain, the one on the top and the one on the bottom. The one on the top is a brain, picture of the brain from the side view, and the set of brains on the bottom is a view of the brain from the top. So if you look at the first brain, so you have ages as well, 5 years, then gradually on to 20 years. If you look at the brain, so by the age of 20, everything is blue, which means fully developed. When you were like 5 and then gradually, you see that the color is like green, yellow, red, etc. So it means that those are the areas of the brain which is not fully developed yet. And as we age gradually, brains, slowly develop. Now, why is this important is the part of the brain which develops the last are the frontal cortex, the front part of the brain. So if you look at my head, I think it will be easier since I don't have any hair to show, to cover my head. So the front part of the brain, like especially around this part, is called the prefrontal cortex, which is responsible for judgment, decision-making, and impulse control. So this part of the brain is, unfortunately, the part of the brain which is developed the last. It usually develops by, they say, like 20, 25. Whereas the part of the brain at the back, which is responsible for emotions, feelings, and pleasures, they are very hyperactive during the teenage years. So this is why teenagers or adolescents are emotional. They are, they love to express their feelings, closing of doors, slamming of doors, and they are so much driven by pleasures and things that they like. And unfortunately, when the front part of the brain is only fully developed by the time we reach, say, 20 or 25, it's so impossible to control the back of the brain. That is the whole, in 5 minutes, why the adolescent brain is so much vulnerable to substances, or not only substances, just life in general. They are driven by emotions, feelings, and pleasure. Suppose, so I am old. I will not say how old I am. I am not so much driven by emotions, feelings, or pleasure anymore. Because this part of my brain is so developed now, right? I'm really not affected by emotions, feelings, and pleasure. Of course, I have normal feelings, but unlike an adolescent, it doesn't have so much effect on me anymore. But a younger adolescent, it's so difficult because this part is not developed yet. So it's easy for them to be, easily influenced by almost everything. And so what works among adolescents? So the New York Academy of Sciences, they were looking at research and looking at so many studies like, so what are we going to do about this? So what works among adolescents? So I just take 2 points. The first one is they said we need to, empower young people with facts about addiction, and not just slogans like "just say no." I mean, so easy to say, "Just say no, don't do this, don't do that." That doesn't really go well with the limbic system of the brain. They don't like to be told, right? So, yeah, we need to, empower them with. So, as you know, today's generation of young people, they want to understand the science behind why things are. Even if you don't tell them, the internet is going to tell them anyway. So they need to know the plus and the minuses. We need to stop saying say no to drugs. That might not work very well anymore with today's generation. They need to know the reasons, the whys and the why nots. And the second point is that, yeah, we need to, give them the full message. Sometimes you even need to give them the plus points for them to hear what you're going to say. If you only tell them about the negative points of drug use, they might not listen wholly. So, why do people use substances and what are the bad effects of substances? Yeah. And then the second point that they said was, so important to teach children how to deal with stress in a very healthy way. I know all of you are educators and teachers. I mean, even children have their own, sets of stress that they will deal with every day. We need to remind ourselves that not every child grows up in a peaceful home, and the pressure to conform, and as we've just said in the previous slide, genetically predisposed to addiction, especially adolescent, as well as if their parents have had history of substance abuse. And PATS is a curriculum which is used in the US, which I thought you guys might find it useful. It's called the Promoting Alternative Thinking Strategies. It's easily available on the website if you would Google PATHS curriculum. So what this does is it teaches young people, in our case, your students, how to, learn self-control, emotional understanding, positive self-esteem, relationship, and interpersonal problem solving. I mean, it's easy to say words like this, and I know it's tough dealing with, a number of students in a huge class, but, at least this could be a starting point for all of us. So arts is a good curriculum that you can look up. And as Shibendu mentioned, you can look at the NIDA website, National Institute of Drug Abuse, USA. Excellent website for teaching materials. You can even look at SAMHSA, SAMHSA, which is another great website for resources like this. I would like to focus on weed. I decided I will not look into all the drugs, but just focus on marijuana, weed, or ganja, whatever name we call it. So let's look at the side effects or the complications of weed. In the US, weed is glorified, as you all know, and even in the Northeast, our young people, they are very much influenced by what they see on music videos, movies, and the lyrics that they hear. But they need to know, what can be the complications or the side effects of marijuana, especially with the teen brain. So it exacerbates existing mental health problem. It makes it worse, whatever mental health issues that they are already having. So the belief is that it makes them feel good about themselves, it calms their nerves and stuff, but when actually it exacerbate the existing mental health problems. The second point is weed users, studies have found that weed users among young people experiences more suicidal thoughts and depression along with anxiety. The third point is medical conditions like risk for chronic cough and lung diseases. The fourth point is very important for our students, problems with memory and learning, long-term effect of marijuana. And the fifth one is they have difficulty thinking and the solving problem part of the brain is compromised as well. So these are, some of the problems that can arise from the use of weed. This was from the CDC website. Did not make up this one. So even when you talk about the harmful effects of weed in your class, even just maybe a couple of points might register in their brain. Yeah. And yes, we were discussing about how adverse life experiences could impact young children as they grow. So a study was done in the US. This was CDC, Center for Disease Control, US, and Kaiser Permanente study done in 1995 and 97. Around 17,000 participants, and mostly middle class, white adults, and health insurance. Why I mentioned the race and the health insurance part is it shows that these are like well-to-do people in the US. And what they found was really interesting. So 28% of them reported physical abuse as kids. And around 21% of them reported sexual abuse as kids, which is 0 to 18 years, between 0 to 18 years, adolescent period. And the finding also showed that nearly half of them had 2 or more adverse experiences during childhood, and nearly a quarter of them had 4 or more adverse childhood experiences. And scientists have found that there was a relationship between having serious health conditions later in life when you have adverse childhood experiences. So what are those adverse childhood experiences? So you can broadly divide them into 3 points: abuse, neglect, and household dysfunction. So under abuse, we have physical abuse, emotional abuse, and sexual abuse. Under neglect, we have physical neglect, emotional neglect, and household dysfunction. We have when either one of the parent has mental illness, when a father beats a mother violently, when there is divorce, when there is an incarcerated relative, which means a father or a mother has been in jail or been put into jail, or when a father or a mother is into substance abuse. So these are the various adverse experiences which were studied under ACEs. So how does that affect the human brain? So what happens when my parents are divorced? So what happens when I see my father beating my wife almost every night? Or what happens when I am sexually abused as a kid? Well, before I studied this, I always saw. I guess it might be the same with you as well. We are so used to saying, "Oh, that's so unfortunate," that things like that have happened to that kid and stuff. But I never focused beyond that. But what they had done at the Center for Developing Child at Harvard University was they learned how stress impacts the brain and how it affects us later on in life and the kind of diseases that we can have due to stress. So is stress, does that mean stress is bad? No, definitely not. So they divided stress into 3 types: positive, tolerance, and toxic stress. So positive stress are the stress which is normal and also kind of essential for healthy development, like coming to Shillong and doing this presentation right now is kind of a positive stress for me. I mean, it's stressful, but not so bad. Sometimes positive stress pushes us to become better or do something good, right? So if you look at okay, let's go to the next slide. So positive stress, something like for a child, it could be like being dropped off at the school, first day of school, receiving vaccine shots. Those can be very stressful for children, but those are positive stress. If you look at the graph, it goes up and then comes down again. It's all right, It's very stressful, but then it's all right. And then the second type of stress that we see are the tolerable stress. Tolerable stress are something a little bit more serious, like facing an exam or my flights being cancelled and all that stuff. So it was so stressful. It was not very positive, but tolerable. Death of a loved one, frightening injury or accident. So if you look at the graph, it goes up, it comes down, it gets better. Then there are days when you feel bad about it, but gradually it wins off. The third one, the toxic stress, is something that was studied in the ACE study in the US. So these are experiences which children face almost every day, or maybe a couple of times a week. And if you look at the graph, it's like goes up and it never comes down. They are like always attentive to the situation, and those are the stress that I have mentioned. Yeah, let's go to the next one. Yeah, those were the stress that we mentioned. So what exactly happened when we have stress? Yeah. So a little bit of biology class again. So when we see something that we are afraid of, or when we hear something that we are afraid of, the brain starts an action. The amygdala in the brain sees or hears the threat or whatever, emotional, physical situation that is being presented to us. And as soon as it sees, what is really important here are the two chemicals which are produced in the body: release of adrenaline and release of cortisol. Those two chemicals are released in the body, adrenaline and cortisol. So these are responsible for, increasing our heart rate. Imagine yourself in the forest nearby, and then suddenly see a tiger. What happens? We sweat, the heart beats faster, and you are so ready to either run away or fight the animal or whatever that you are facing. That is possible because of the two chemicals that were released, cortisol and adrenaline. It makes us aware of our surrounding. It increases the pupil size so that we can see clearly, and makes us ready to, and all the sugar, is pumped out and is ready for the muscles to do whatever has to be done. So that's how the stress system works. Yeah. But what happens when, the chemicals are released almost every day in the body in a kid? It really is not very healthy for the kids. Those are meant only for a couple of minutes, like crossing the road and then you see a car and then the chemicals are released and then you become normal again. Fine. That's how a normal stress response should be and is. But when it becomes a toxic stress, something which happens continuously in their life, the two chemicals are continuously released in the body. So what happens? Young people with so much stress in their lives, studies have found that among those children, there is early initiation of alcohol use, higher risk of mental and substance use disorder later on in life, prescription drug use, they're more prone to using prescription drugs, and there is a lifetime illicit drug use, drug dependency, and self-reported addiction among children with lots of toxic stress or ACEs in their lives. So I was like wondering while I was in the US, so I was like keeping Mizoram in mind, like what could be the possible ACEs in my state, which might make the Mizo kids vulnerable to substance use. So something that even you guys can look up is the divorce rate in your state. We can even look at the physical violence between intimate partners, which are available on the National Family Health Survey 5 on the website, easily available for each state. You can look up and see you can hypothesize this could be the reason why maybe some of our young kids are more prone to these kind of things later on in life because of divorce and because of physical violence between intimate partners and stuff. And let's look at the brain. What happens when a child is continuously stressed out? What happens when the two chemicals are continuously released in the brain? So if you look at the brain above, that's a scan of the brain. You can see that there are multiple wires. Those are the neurons. So we are supposed to have multiple wires and neurons, which is good for the brain. But if you look at the scan below, you will hardly see any multicolored wires or neurons, which means is that toxic stress have huge impact on the brain. It's not just their parents are divorcing. It's not just about their father, beating his wife on a regular basis. It has a deep, deep impact on the brain as well. So how does it affect the brain? There is an increased risk for attentional, emotional, cognitive, and behavioral disorders among those kids. There is a high level of negativity, poor impulse control, personality disorders, as well as low levels of enthusiasm, confidence, and assertiveness. The third one is there is a risk for learning difficulties, poor school achievement, low IQ, and poor reading skills among those kids. There is greater risk for anxiety, depression, cardiovascular problem, and other chronic health impairments later in life. So, as you can see, it can have such a huge cascade of health implications later on in life. So it's a very serious situation, and we need to identify kids who may be having ACEs in their life. There is a ACE scoring test which you can do even among your kids, among your students, and see the number of ACEs that they have. Yes. I would also love to, would like to bring good news, because so far I feel like I've been, saying very, bad things about stress and how, complicated it is. But another study by the Harvard University, I think this was very optimistic, and it also gave me a sense of hope and purpose for the work that I do back home. If you look at the slide and the blue curve, so, and then you can see it starts from 2, 4, 6, 8, 10 the age, and goes up to 70 years. So if you look at the curve, so the blue curve is the brain's ability to change in response to experiences. So as you get older, it becomes more and more difficult to change your brain. I think that's true, right? Look at all of us, so difficult. I mean, we are not easily influenced anymore. I mean, there are times when things happen, but most of the time we are not. Our brain is very static. And also the yellow, the orange curve, it goes up. So, the younger you are, the less effort you need for any change to happen in your life. So, you guys are dealing with young people who are vulnerable to substance use, and at the same time, you are also dealing with young people where they're in a stage where their brain is so malleable, right? So I think this is a good slide and something that we need to remember. Bad things might be happening in their lives, but there is still an opportunity to make changes in their lives. At least till, say, 20, 25. Once we cross that age, everything becomes so difficult to learn new things. And we need so much effort to, to do whatever we have to do in life. Another group work which we will not do, and physical warning signs. I think Shivendu did this as well, but this is more medical. So these are the physical warning signs: bloodshot eyes, the pupils, the black, the pupils may be dilated or it might be big when they're intoxicated. Problem sleeping or sleeping too much. That's not normal. So that's something that we need to think about. Weight changes, abrupt weight changes, something that you need to looking unkempt. Usually it's not like this, but the past few days, what's happening? Change in energy. Sometimes they will be very energetic, or that they may look very tired, depending on the substances they use. So these are the basic physical signs that we can look into among our students. And then the behavioral signs like sudden change in friends, place of hangout, hobbies, sudden mood swings, irritability or angry outbursts, unexplained change in personality or attitude, appears fearful, anxious, paranoia, and with no specific reason, drop in attendance and performance at school or work. I think these are things that you are familiar with, and maybe something that I just wanted to reinforce. Yes, and how do we, you know, I think I needed to share at least like one screening technique that you can use among your students. So CAGE is very basic. It doesn't have to be administered by a physician or a nurse. CAGE questionnaire very much used in the US and the outpatient department. So it's 4-question screening tool: CAGE, cut down, angry, guilty feelings, eye opener. So the first question is, so you are suspecting him or her of whatever some substances. So you do not know specifically what it is, but so you will ask them like, do you feel you need to cut down? Second point will be, do you feel angry or annoyed when your family, friends, or people who care for you ask you to stop using that substance, whatever that may be? And do you have guilty feelings about the whatever substance that you are using? And the fourth one is an eye opener, which means that is that substance the first thing that you think in the morning, or is it something which is constantly on your mind? So, CAGE questionnaire. So, just 4 basic questions. If it's all 0, then maybe you don't have to worry so much. But once it's 1 or 2, then they need to be referred to higher centers or counselors or medical practitioners for further evaluation or management. If it's more than 2, then definitely whatever substances that they are doing, even if they are denying at that moment, is starting to become a problem in their life. So this is a CAGE questionnaire, very easy, and I hope you find it useful when you go back. Treatment, not going to talk so much about this because I know my time has run out. I would really love to do a little bit of motivation interviewing. Should I do? I don't know whether I have time or not. Okay. Yeah, let's go. Yeah. So my fellowship in the US was mainly focused on the psychological treatment of addiction and counseling with focus on motivation interviewing. So what we learned with MI was that past treatment or the traditional treatment was mostly focused on a very confrontational and intense kind of therapy, wherein a therapist or a practitioner or a counselor will try to persuade or force a patient to change. So now the theory is that those kind of counseling wherein you persuade or you intensely confront a person do not work. So the goal then was to break down the client's denial, defenses, scold them, make fun of them, or make them feel bad, things like that. But what they've learned is that does not work. But anyway, the belief was that people are using substances or they continue to use substances because of the lack of motivation or there's resistance within the addicted individuals. So those are the reasons why they do substances. So the thought was that the only way to give them motivation or to break down the resistance was to confront them. And I think this is the kind of counseling that we are so used to. Whenever I get phone calls from parents, it's like, can you please make sense, say something, scold him, or in my Mizo language, it's lo hao shepro, which means, why don't you please scold him, I don't know what the equivalent you have in your languages, but that's usually the kind of counseling which is expected of us. To scold them, to confront them, and make them realize what they're doing is wrong. But what they find is that that does not work. And our fantasy was that people with substance use disorder, we fantasize or we like to believe that they recognize they have a problem. We think that they need help with the problem or they want treatment and are ready for change. But the reality is, it might be true for some people, but most of the time, people with substance use disorder do not want treatment. Sometimes they are unable to stop, or sometimes they are not very sure whether to stop or not stop. So ambivalence. Ambivalence is, as you might know, is simultaneously wanting something or not wanting something, and it's a human nature since the dawn of time, as we all know. Ambivalence is normal when people are looking at changing something important. And there is normal tendency for people to protect the side that they don't want to change. So ambivalence is very common when people come to us for treatment, and that is something which motivation interviewing tries to address. So what is motivation interviewing? It's a it's a conversational style. It's a way of being with other people. Main aim is to strengthen the person's own motivation and their commitment to change. So that is what MI tries to do. I know that sometimes some of our patients do not have motivation or commitment to change at all, but when you really dig deep into them, you'll be surprised that there'll be a little bit of motivation or a little bit of commitment to change deep down. So that is what MI tries to do. It's not very easy, and within a couple of maybe 5-10 minutes, I would only have time to look at the basic skills of MI, which we will do, which are the OARS, OARS. These are the basic skills of MI, which anyone can, make use of. Open-ended questions, affirmations, reflections, and summarizations. I would like to do the first three this time. So open-ended questions are questions that cannot be answered with a yes or no response. Example would be, I understand that you have some concerns about your drinking. Can you tell me about them? Versus, are you concerned about your drinking? He would have just answered yes or no, but when you ask him with an open-ended question, you give them an opportunity to talk more about the problem that they are having. And also, it invites a person to think and reflect a little bit about the situation that he is in before they respond. So, why open-ended questions in MI? They say that it helps in engagement with the patients, which is a huge part of MI. Open-ended question helps with engagement, and also it plays a huge role in evoking motivation and planning a course towards change. And also it gives the counselor or the therapist an opportunity to learn more about what the patient cares. And it gives an opportunity for the patients or in your case, students to talk a little bit more about the situation that they're in. Other kind of open-ended questions could be things like, what brings you here today? How has this problem affected your day-to-day life? Or things like, where do you think this path that you're on is leading you? Versus, you should stop doing drugs. Versus, don't you know that this is very bad for you? We are so used to giving those kind of counseling, but they say it does not work, it does not work. So we need to ask more open-ended questions because it gives you an opportunity to learn more about the patient. It helps with engagement as well. Second one is affirmation. Affirmation, I felt it was such an American thing because they are so used to saying very good, nice things to you when you see them. The first few months I was there, I was like, oh God, how am I going to manage all the good morning, hi, hellos, and thank you for the next 1 year that I was. But by the time I was in my third, fourth month, I was like doing more, good mornings and thank yous than the Americans themselves. So, it kind of like rubs with it on you, right? So affirmation is to recognize, acknowledge, and highlight the positives. I think this is something which we rarely do in India and even in the Northeast. Example like you handle yourself really well in that situation. You are determined to quit smoking. You have been really strong in spite of all the problems that you face at home. So when I see or when I am with a person who, irrespective of all my, being bold and everything, but still gives me compliments and affirmations, I feel like being with that person all the time. I feel like listening more of what he has to say rather than the first comment being, what happened to your hair, right? So we need to have more affirmations if we are to engage with other people. With us Mizo, I hope my Mizo people will not mind. We are so used to asking direct questions like the first time we meet. Common affirmations would be things like, when are you getting married? How come you're still single? Or how come you guys don't have kids yet? I don't know whether this is common with other northeastern cities as well, but would you like to stay on with them? Most probably not. You try to run away from them, versus someone, who says like all the little positives that you have in your life. So affirmation is a big thing with motivation interviewing. So when I see my patients, when they come visit me, say after 2-3 weeks, and then they tell me that they have relapsed again. But the things that I would say are things like words of affirmations like, "Oh, that's really unfortunate, but I'm so happy that you were able to, abstain for the last 2 weeks." So they would prefer coming back to people who would, affirm whatever positives that they have in their life. So that is one big part of MI. Yeah, let's go to the third one, probably the last one for today as well. So reflection, again, is a big part of skill of MI. This is something that all of us can learn as well. Rephrasing a statement to capture the implicit meaning and feeling of a patient's statement. So examples are like, so you're talking with someone, you are having a counseling session with someone, so he or she is telling you about how worried he or she is about the impact of how drinking is impacting his or her health. So reflections would be like, you are beginning to worry about the impact drinking is having on your health. Or things like you found out your health has been affected. Or for a student, it could be like, you are annoyed your score is low despite working so hard. Reflection is what the speaker said by you just repeat or summarize whatever you have heard. So why is this important is that what they've learned is that it encourages, personal exploration and helps people understand their motivations more fully. And then the client, they feel more heard when you kind of reflect whatever they were saying. So this is also a huge part of MI, and I think that is what we will learn from MI today. And who benefits from MI? I wonder if you can read. So what they've learned is that clients feels more respected. Clients feel more like collaborator because it's a two-way thing versus a traditional counseling where the counselor will give you a lecture for 1 hour and you just keep quiet. They feel more understood, less blamed. They feel more empowered to decide if they want to make a change. Remember, you can't change people. Only people can change themselves. We are just a guide along the way. If you try to change people, man, you will be so burned out. Feels like change can be a positive experience. And with the practitioner, we feel more connected and we do not scream at patients anymore. It's such a positive experience. We feel more relaxed. We feel less responsible about changing other people. Work becomes easier for us. So that's in a nutshell what an MI is. MI is a whole semester, 6 months of study. So I'm just giving you a brief glimpse of what MI is. And I would like to end with a reflection by Blaise Pascal, who says, people are generally better persuaded by the reasons which they have themselves discovered than by those which have come into the mind of others. So it's all about trying to invoke the internal motivation, trying to invoke the commitment of change that a person has versus you trying to enforce external motivation or change. They say finally at the end of the day, we can't change people, only people can change themselves. We are just a guide along the way. Yes, thank you so much for your time and patience.
Thank you very much, Dr. Ralte. And I realized that we should have given more time for this workshop so that we could have actually engaged in some of that group work and some of those reflections and activities. Thank you for giving us a very scientific understanding of vulnerability to substance abuse and why adolescents especially are more at risk, and doing it in a very nice, colorful, through colorful visual media. So thank you so much for that. Uh, so some of the very important things that we just understood from your presentation were promoting alternative thinking strategies, curriculum, and also Dr. Ralke was able to inform us of some relevant resources which we could access for enhancing our competency for dealing with substance abuse disorders, and not disorder, but even just to prevent substance abuse. And the case screening questionnaire, and the especially the motivational interviewing technique, because this is something that we have been hearing of a lot now, and it's a good counseling skill, I feel, and there are a lot of things in the motivational interviewing skill which overlap with the counseling skills. So we could make use of at least the three things that we have learned today. Um, so a lot of information compacted into 1 hour, and so thanks a lot for everything that you told us, Dr. Rajit. And with this, I would like to invite the last speaker for this session, Ms. Anupam Talwar, who's a who's a practicing counselor in Delhi, and she has vast experience in dealing with children with substance use problems. So she's here to share her reflections on her experiences with children who are at risk and vulnerable to substance use. Ms. Talwar, please.
Good afternoon and namaskar. Am I audible? Shall I continue?
Yes, you're audible.
Okay, thanks. Firstly, I'm really grateful for this invitation to share my experiences as a practitioner. I've in fact been on edge, hoping that I'd be able to make the most of this amazing opportunity of connecting with, inspiring, empowering, and positively touching the lives of so many educators across India. And that actually got me thinking as to how blessed you teachers are. Each and every one of you educators get this opportunity each and every day that you walk into school. An opportunity to make a difference, to inspire. You educators have the unique opportunity to sculpt our society. You have the ability to gift our children a beautiful bachpan, a happy childhood, such that they learn optimally and grow up into well-adjusted individuals. However, since the focus of my talk is managing substance abuse, it gets us to a question. Can just any teacher at all contribute towards a specialist issue such as substance abuse and mental health in schools? The answer is yes. Some would ask though, hey, would you have to undergo specialist training before contributing, right? The answer to that is no, not necessarily. In fact, each of you educators can start actively contributing to this issue as early as tomorrow morning at school. Am I oversimplifying the issue? No. I'm only going to do that which counselors do best. Help you tap into that which already exists within you. Let's get started. The first thing that you'll need is a desire to be able to positively contribute. Very simply put, if you want to, you will be able to. Rest assured. In fact, it is the make or break of whether or not you shall be successful in your endeavor. What comes next is being aware. Being aware that this is a very pertinent psychosocial issue that affects the mental health of students and thereby directly affects their academic performance and also their overall quality of life. Gaining basic knowledge, or the term that we have been using through this conference, mental health literacy regarding substance abuse and addiction, as was shared with you in the sessions preceding mine. So all that is the awareness that you have already gained. You are now relatively literate about substance abuse. So what else can you do in addition to being aware? Be alert and observant. Of what? Be alert and observant of the social climate of your school, of the community around. What TV shows are trending? What possible beliefs regarding substance abuse are getting promoted? For example, be it the Western show, the ever popular Friends, or nowadays, some of the contemporary Indian shows, or I might even go to say most of our contemporary Indian shows are showing drinking, smoking joints. They're all being partaken by the so-called good, well-balanced, successful characters in the shows. So is it about sitting in judgment about the appropriateness of these shows? No. We simply have to be aware that this is what our children are watching and probably believe in. Be observant of how prevalent is social drinking and smoking in your community. Look around, find, are there any substance abuse related myths? For instance, we often believe that cannabis edibles are safer than smoking a joint. However, the reality is it is much easier to overdose with a cannabis edible. A lot of children nowadays believe that choosing weed over alcohol is a healthier choice. Anyhow, what more can you do by being alert and observant? You can identify the potentially at risk or vulnerable students. Identify the miscreants. I'd like to add here, please don't rush into labeling our miscreants as problem children. Look at them as children with problems instead, and you will surely be able to help them appropriately. More about that a little later. So, okay, now that you're ready with sufficient information and data and are ready to begin your communication with the students. But wait, firstly, you have to stop and look within. What are your personal values regarding substance abuse? Do you drink, smoke, chew tobacco? Have you ever experimented with drugs? So if you answered yes to any of these, does that disqualify you from talking to students about substance abuse? No. For all we know, it will probably make you an even better spokesperson. What's important is how comfortable would you be talking about these with your students? Here is where the leading by example and teachers' own mental health components fit in. See, mental health is not the absence of mental illness. It is about self-awareness and being comfortable in our own skin, being at ease, being ourselves, understanding and accepting ourselves as is, not being pretentious, not being ashamed of parts of ourselves. So a teacher who is self-aware and at peace with every aspect of themselves is able to let go of the moral high ground and connect with students with complete honesty and genuineness, without the fear of being judged. Children, they are very quick to gauge honesty and are just as quick to reward it with trust. And once they trust you, they will be willing to listen to and follow whatever you have to say. This part, though, takes a lot of courage, but it is so worth it. Think about it. Would you rather be the teacher who says candidly to her students, I smoke, I want to quit, but it is so addictive, it's not easy. I wish someone had spoken to me about it when I was young. I wish I had refused that first puff when I was offered. Or would you be the teacher who moralizes about the sins of smoking and is later spotted by her students smoking herself? So, your personal experience with substances, if any, do not qualify or disqualify you. It's your willingness to approach the topic with complete honesty. That's what matters. Again, now this gets us to one another apprehension. We often fear that openly talking about substance, all substances available, would amount to promoting, encouraging, or validating the behavior. Research, however, has shown that talking about it actually promotes prevention. It helps satiate curiosity. And more importantly, it ensures safe usage and reduced abuse. So, okay, now you're ready? You're ready for the next step. Talk. Have interactive sessions on advocacy and awareness for all students. Have targeted discussions with core group of students. Talk. But don't just talk. Be willing to listen too. Listening is just as important and a very important contribution that you teachers can make. Listen without judgment and with genuine concern. Hear what they have to say about it. In classroom discussions, in small group talks, in a one-on-one chat, make them feel heard and understood. While a certain percentage of teens are expected to experiment with drugs no matter what adults say or do, for most, substance abuse is a faulty coping mechanism aimed towards tackling some or the other underlying unresolved issues. It has been taken up in detail in the previous sessions. Nevertheless, I would like to mention it here too. You have to remember when I said they are children with problems? That's what I meant. So, just taking a few instances, in some cases, the issues are very obvious. The child who under parental pressure to perform well academically, very high scoring, always scoring well in academics, so under pressure that my scores can't drop. So she took to taking substances which would improve her concentration, make her sleep less, and so on. Yet another child, struggling with academics, barely able to pass, and so took to smoking because it helps him focus, helps me concentrate. That was his take. Yet another just did it because he wanted to fit in. He wanted to be part of a group where everyone was doing it. So he had to too. But for some children, the underlying causes may be buried a little deeper. When an all-rounder, good at academics, sports, leadership, and yet succumbed to substance abuse, what came to light was that he had unresolved issues. He had had adverse childhood experience. He had had an adverse childhood experience. Yet another similar case was a girl who was battling with her sexual identity. So our children can have a whole variety of problems underlying this very obvious problem of substance abuse. So what you are doing is you are being there as a trustworthy adult, listening to them with genuine concern and without judgment. And this can be a rather therapeutic experience for the students. And it may actually help them overcome or come to terms with some of their stressors and their underlying issues. But you don't have to get overwhelmed though. You, as educators, as teachers, are not expected to resolve their issues or offer solutions. All you need to do at this point is motivate the students who need it to seek help. Guide them towards the right place or the person to seek help. Don't underestimate your role here. Most students don't even know that they can or need to seek help. And of those who do realize it, many are stigmatized by the idea of seeking professional mental health. So your role in motivating students towards seeking help is paramount to their healing. Okay, so what else can you educators do to manage substance abuse in schools? You can, like what Sir said during the keynote address, create a positive school climate. Normally in schools, it's a done thing. If a student is known to be into any form of substance abuse, they're often labeled and treated as outcasts in the school. Obviously, no. If we were to be kind and accepting towards such a student, the wrong message would get conveyed. Other children would think it's okay to drink or to smoke or to do drugs. No, that's not how it goes. This is where you can bring a change. Remember, disapprove the behavior, but accept the child. It's good if you can remember here that he or she is not a problem child. She is a child with a problem. She needs your help and acceptance. This is very important towards not just helping this child, but also it contributes towards creating a positive school climate which is conducive towards good mental health and well-being of all. And lastly, I would like to give you teachers a magic wand. So let me first share a very simple experiment. One subject, one very simple task, something like marking all the alphabet A's on the given page. All right? Done under two different conditions. So this one subject has to do the same task. The two different conditions are created by us, the experimenter. So condition A is, irrespective of how the subject is performing, the experimenter keeps saying appreciative and encouraging things like, wow, you're doing great. You're really good at this. And condition B, irrespective of how the subject is performing the task, keep giving negative inputs like, come on, hurry up. Can't you do better? You're no good at this. The result? The subject performed statistically significantly better under condition A, the one under which he was being appreciated and encouraged. Something as simple as this. It is often referred to as the Rosenthal effect. It is an established fact that your students will match up to your expectations of them. And when I say they will match up to your expectations, please note, they will either live up or live down to your expectations of them. So each of you can make magic happen simply by remembering to appreciate and encourage. Simple phrases like, I know it's tough, but you can give up this habit. It's praiseworthy that you have recognized it as a problem that needs help. I believe you have the willpower to say no. Good, I can see the effort you're putting. Simple phrases like this. All you need to do as teachers is just remember to appreciate and encourage. And so the magic wand I was talking of, it's here. This is the magic wand for you. A pen. Something that every teacher always has on their person. So how is this a magic wand? See, how do you spell a pen? Let the A-P remind you to appreciate and the E-N remind you to encourage. Just carry this always and use it as a magic wand and see magic happen. So this is a nutshell of what I wanted to share with you. I'll just take another 2 minutes for a quick recap. Just give me a second, so I'll share my screen. Okay, I am unable to share my screen. May I request, can my slide be shared from your end, please? I'm unable to share my screen. Okay, so maybe I'll just proceed. Without my slide, you can just continue to see me speak. So the quick recap basically is, firstly, you have to want to make a difference. Next, be aware, gather basic awareness about whatever. Like in this case, we're talking about substance abuse. Next, be alert and observant. Gather inputs from your community and school. After that, do remember to first look within, understand and accept yourself. Don't step out feeling vulnerable. Talk about it with honesty and genuineness. Listen with genuine interest and without judgment. Motivate whoever needs to be motivated to seek help. Please don't take everything upon yourself. You don't have to. Create a positive school climate. Disapprove the behavior, but accept the child. And lastly, of course, your magic wand, a pen, AP, appreciate, EN, encourage. So always carry your pen and you can actually create magic. That's all from me for today. Thank you.
Thank you very much, Ms. Talwar. And yeah, the magic wand you refer to is something all teachers can have access to, and they can really do that bit for making a change in the lives of their students. And an important thing that you have emphasized is to disapprove of the behavior and not the person. So which is very important not only for substance use but for anything, for any behavior that we do not like. And this is something which I have also been thinking of, that we often say that the person is depressed or the person is psychotic. It's not the person. You don't say that the person is jaundiced or the person is when we are talking about physical illnesses, we say someone is suffering from typhoid, someone is suffering from jaundice. Similarly, we need to change the way we talk about the problems so that we can deal with it in a different manner. So thank you very much for those very important insights from your own private practice and from your own personal experience with children. Um, I hope this was a good learning experience, this whole session, and substance abuse as a major issue was dealt with. And I hope it has given everyone some resources, some skills, at least set everyone thinking about how they can uh, manage the thing or begin to handle it. I think it's time for a short tea break, and we will reassemble maybe after 15 minutes. Short? Okay, so our participants, because they didn't get any break till lunchtime today, so they need a big, longer break. So maybe we will assemble after 25 minutes.